Today's topic is Down syndrome. Down syndrome, it is also called as trisomy 21 because it is caused by the presence of all or a part of third copy of chromosome 21. In this syndrome, there are 47 chromosomes instead of the normal 46 chromosome. This syndrome is associated with the developmental delays, mild to moderate intellectual disabilities, and characteristic physical features. They occur 1 out of 800 births worldwide. This is an English physician, John Longdon Down. He has first described the Down syndrome. He considered it as a Mongolism or Mongolian idiocy. The name Down syndrome is given on the name of John Langdon Down. In 1950s, there was a discovery of karyotype technique and it became possible to identify the abnormalities of chromosome number or shape. Therefore, in 1959, French pediatrician Jérôme Lejeune reported that the Down syndrome is resulted from an extra copy of chromosome 21. As a result of this discovery, this condition became known as trisomy 21. The World Health Organization dropped the term Mongolism in 1965 after the request by the delegation from the Mongolian People's Republic. Now this disease is considered as the Down syndrome or trisomy 21. Let's see some signs and symptoms of this disease. So the patient who has a Down syndrome has a low IQ, severe mental retardation due to the defective development of the nervous system. They have a epicanthal fold over their eyes. Their hands are short and broad. Their height is below average. They have a large tongue with the distinctive furrowing which protrude out of the mouth. Broad skull and face with the wide nose, poor muscle tone and irregular teeth. There is an abnormal creasing of the skin on the back of the hands. Eyes are slanted and pointed upward. Their nose bridge is flattened. The male have a poorly developed genitals and are almost sterile. Susceptibility to the infection is high due to the low lymphocyte count in a blood. They have a small underdeveloped ears. They may have a hearing and vision problem, blockage of the intestine and the short fingers and the toes. More than 1 in a 3 children with Down syndrome have a heart defect. Liver and spleens are enlarged. There is also an increased rate of leukemia and reduced effectiveness of the immune system. Despite this problem, people with the Down syndrome, particularly those with the good self-help skill, can expect to live into their 50s. There are 3 types of Down syndrome: trisomy 21, translocation Down syndrome, and mosaic Down syndrome. 95% of Down syndrome is due to the trisomy 21, while 4% is translocation Down syndrome and mosaic Down syndrome are rare. Trisomy 21, in which there are extra copy of 21 chromosome, is present in the every cell of the fetus. In 95% of cases of trisomy 21, it was due to the egg cell from the mother that carried the unwanted extra chromosome. Older the mother, higher the chance of trisomy 21. This translocation Down syndrome is about 4%. Child inherit a extra section of 21 chromosome, but instead of being a separate, this chromosome section is attached or translocated to the end of the another normal chromosome, that is usually chromosome number 14. While mosaic Down syndrome is very rare, can occur pre or post conception and result from a mistake in a cell division within the growing embryo. Consequently, only some of the fetus cell will have a trisomy 21. So there are 2 types of prenatal tests are available to detect the Down syndrome. Number 1 is screening test. Number 2 is diagnostic test. Screening tests are non-invasive and generally painless, but because they cannot give a definite answer as to whether a baby has Down syndrome, mostly they are used to help the parent to decide whether to have a more diagnostic test. Screening tests include neuronal transfluency testing, the triple screen and alpha fetoprotein plus and detailed ultrasound. Diagnostic tests are about 89% accurate in detecting the Down syndrome. It involves the amniocentesis and chorionic villus sampling. This amniocentesis takes place between the 16 to 20 weeks of pregnancy. It involves the small amount of amniotic fluid through the needle inserted into the abdomen, and cell can be then analyzed to the presence of chromosomal abnormalities. Chorionic villus sampling is involved in taking a tiny sample of placenta also through a needle inserted in the abdomen. The advantage of this test that it can be performed earlier than the amniocentesis between 8 and 12 weeks of pregnancy. So age of the mother is the primary risk factor for the most common form of the Down syndrome. Currently, there is no treatment for Down syndrome, but complications resulting from it can be treated. Thanks for watching. If you like this video, make sure to subscribe for more.